Hello everybody, I am Dr. Ikeda Lal. I am an additional director at Delhi Eye Center and consultant at Sir Gangaram Hospital, New Delhi. I am a cornea, cataract and refractive surgery consultant. So cataract surgery has evolved immensely in the last couple of years. If we look back at, say, before the World War, the intraocular lenses that we have today, which are the lenses that we implant inside the eye after we remove the cataract, weren't even invented. So all we used to do was remove the cataract from the eye and the patient was left without a lens inside the eye, and that led to a very high power that the patient had to wear to make his vision clear. Then during the Second World War, Sir Harold Ridley came up with this idea of making the intraocular lenses and how they have evolved in the recent years. Now with the latest technology available, the intraocular lenses have become foldable, and the cataract surgery has evolved in such a way that these days we perform phacoemulsification surgery, where the incision size, what used to be say 8 millimeters, 10 millimeters when these machines were not available, has gone down to even 2 or 2.2 millimeters with the latest technology. So where we stand today in terms of cataract surgery, we do this surgery under topical anesthesia, which means we do not need to give an injection to anesthetize the eye for more than 95% of our patients. And this leads to a very quick rehabilitation because the patient doesn't need to be patched. There are no stitches involved, again, for more than 95% of the cases. And we use this phacoemulsification technology to break down the lens, remove it from the eye, and with the same small 2 to 2.2 millimeter incision, we can fold the lens and inject it inside the eye, and it opens up beautifully once it's inside the eye. So this surgery has become very, very comfortable with excellent results, hardly any restrictions on the activities to the patients after the cataract surgery. If we look at the advancement in the last couple of years, the lasers have come into cataract surgery, which is known as femtosecond laser assisted cataract surgery. They help in opening up the capsule, which is the bag in which the lens is placed. So we have the lens of the eye, which is encapsulated in a bag. We have the top layer called the anterior capsule and the back layer called as the posterior capsule. So the lasers help in creating an opening in this anterior capsule and also entering the eye. The drawback of the laser was that it has to be set up in a different OT altogether, not in the same OT where the phacoemulsification or the machine that breaks down the cataract is placed. And also it costs much more to the patient. So to tackle these two issues, the latest technology that has come in, say about 5 years back, is now precision pulse capsulotomy system. So it was launched somewhere around 2016, which is a machine which can be placed in the same operation theatre, and it makes an opening in the anterior capsule and it does not take as much time, and it is much more cost effective to the patient. So these are the two advancements which have happened in the last couple of years. LASIK has evolved over the recent years and has become a very efficient technology to take care of the glasses. Earlier, we used to have only the microkeratome system to do the LASIK, and if we look at even before that, we had only PRK technology. Now the laser systems have evolved so much that we can do everything with the laser. We don't need a microkeratome anymore. We use two lasers to correct the eye power, which is known as the femtosecond laser, and the second laser is known as the excimer laser. The outcomes have also improved because of the pre-operative assessment. We have very accurate machines now to assess the suitability of the patient. Therefore, in a nutshell, we can provide very good outcomes to our patients, and patients these days desire a better quality of life when they are assured that the surgery is safe for them and they are going to have a good outcome. LASIK becomes an ideal choice for them. Corneal transplant is performed for patients who have corneal opacity or corneal edema, which enables the patient not to be able to see clearly with his own cornea. Now earlier the corneal transplant that used to be performed was a full thickness corneal transplant known as penetrating keratoplasty, and that was the only option we had say 40 years ago or 30 years ago. In the last couple of years, the technology has advanced immensely, and now we can do lamellar corneal transplants, which means we can selectively transplant that part of the cornea which is defective. If the topmost part of the cornea is defective, in other words, if the stroma is defective or has scarring, we can do a DALK surgery, which makes sure that the innermost layer of the cornea, which is called the endothelium, remains intact and it's patient's own. If the endothelium is defective, which is the innermost layer of the cornea, which causes swelling or corneal edema, then we can selectively replace that layer with the help of DSEC or DMEC surgery. So, we can replace the layer which is defective. In all the cases, we do not need to replace the entire cornea. This does two things. One, decreases the chance of graft rejection as we are using somebody else's tissue. Second, decreases the need for prolonged eye drops that is required. And thirdly, also provides faster visual rehabilitation. The future is bright for us. We have a lot of development in the technology which is on the way. If we look at cornea, there is a lot of advancement and a lot of research going on in the field of keratoconus, and a lot of new surgeries have been devised. If we look at corneal transplant, specifically endothelial transplant, we have cell injections which will be available soon in India, which can take care of the endothelial disease, and we do not need to perform a surgery, and this will bound to happen in the next decade or so. The third advancement that we are looking at is the role of AI in ophthalmology, specifically in patients who have a diabetic retinopathy, or because of diabetes if their eyes are affected, and AI technology can identify this, grade it and decide which patients are normal because they are fed data of a lot of patients to be able to identify this. If we look at corneal infections where healthcare is not easily accessible, the AI technology can actually monitor whether the patient has been getting better on medication or not. So these are the advancements that have come in a big way. So the future is bright and lots of new technologies and new devices for us to look forward to. Delhi Eye Center was started by my father, Dr. Harbans Lal, around 30 years ago. And over the period of years, how we have evolved, we have created this center that we currently have now in 2016. In one roof, we have all the specialties of doctors available within the eye surgery. We have the latest technology including LASIK, precision pulse capsulotomy or Zepto cataract surgery with all the best quality lenses, all the different kinds of corneal transplants as well as retina surgeries and pediatric ophthalmology. We are based on three main pillars. First is compassion. Patients are the most important to us, and it is not just important to treat them, but to treat them with compassion. Second is to provide quality eye care to all of our patients, and this is an amalgamation of good doctors as well as the latest technology under one roof. And third is affordability, so that we can reach to maximum patients and help them benefit from our services.